I bet you won't be able to list all these findings in under a minute without knowing our Moon story. A 28-year-old patient presents with high myopia, that is myopia more than 12 diopters, and she undergoes fundus examination. Which of the following fundus findings is most characteristic? For this, we have to know all the fundus findings of pathological myopia. Why pathological myopia? Any myopia more than 6 diopters is considered pathological myopia. So we'll see all these features one by one. So the story goes like this. First, remember the full moon. It has minor small cracks all over it, which depicts our lacquer cracks, which are fine breaks in the Fuchs membrane, the innermost layer of choroid. Then remember the crescent moon. This depicts temporal myopic crescent, which is zone of chorioretinal atrophy around the optic disc on temporal side. Then we have the moon surrounded by clouds all over it, which causes a tessellated or stripe-like pattern all over it, which denotes a tessellated or tigroid appearance. This occurs due to diffuse attenuation of retinal pigment epithelium. Then these clouds pull the moon away from the place. That is, the clouds put traction on the moon, which is super traction. This also leads to tilted optic disc. This causes no pain but can cause loss of central vision or blurry vision. Then there develops a small dot in the moon, which is of Foster Fuchs spots. This is areas of subretinal hemorrhage at the macula. Then the moon is fed up with all these actions, so it starts growing, but it absurdly grows in the posterior side. This denotes thinning of sclera and pushing it bulge on the posterior side. This causes posterior staphyloma. If you're following along till this point, make sure you follow the channel as well. So the answer to this question is tessellated or tigroid fundus with temporal peripapillary crescent.